Let's talk about Vietnam or Umbilical endometriosis. That's the video. We can explain with that about physical and external aspects of Vietnam. We can start with the definition. Umbilical endometriosis, also called Vietnam, was first described by Beer in 1806. It is extremely rare, the incidence being only 0.5 and 0.01% of the woman with external or external endometriosis. This condition should not be mistaken for scar endometriosis occurring in umbilical incision scar. We have some symptoms and complications. Menstrual bleeding in different areas to the uterus, previous series, and same patterns, multi-menstrual bleeding and umbilical. One discussion. A form of tension present with a painful smelling in the umbilicus. Ultrasonography demonstrates a hypodense node of 1.88 cm, serial escalation delay, and subcutaneous dark incolor loaded swelling, and the burden of the umbilicus with turning up to be. This is an interview about if the UA say that occurs in young women, yes or no. Some persons talk about that
wondering if it's always going to be like this. How was it the point where I was in pain today? How am I going to accommodate it when I'm
we continue with now we have professional opinion about that
I am 19 years old. I'm from Florida. I am enrolled at Community College. Thinking about nursing or respiratory therapy, not quite sure yet. I'm actively involved in my church, Catholic Christian. My dad's a minister. I love to shop, love to read. I was actually in the 5th grade, and I started getting pain in my right side. I didn't really think anything, I thought, oh well, maybe it's appendicitis. So I was taken to the emergency room. They did CAT scans, ultrasound, and they couldn't find anything. They told me that it was a stress spot, that I was stressing too much. And released me. And the pain just kind of went away after a while. And then it kept happening every year. I kept getting the pelvic pain. And I kept going to the doctors trying for them to find something, and they never could find anything. They kept telling me, oh, you're just stressed out, you'll be fine, just part of being the girl. I'm like, oh, okay, just kind of, I'd said in my mind I was going to deal with the pain for the rest of my life.
So from the gynecologic standpoint, one of the most common reasons of pelvic pain is endometriosis, which is, simply speaking, the glands that belong to the inside of the cavity of the uterus find their way outside of the uterine cavity and adhere to the ovaries, to the tubes, the bladder, the bowels, the pelvic side wall, and start thriving there and leaving it every month, causing a lot of chronic inflammatory reactions and scarring from a lot of pelvic pain.
I started having severe pain. I was throwing up. I sweating. It was terrible. And my mom came in to check on me. She heard me one night. The pain had just gotten so severe, and they immediately took me to the doctor. And they did an ultrasound and found a mass. They told me it was a cyst. They said that it was a cyst that they had found in my right ovary, and it was 8 centimeters. It was the size. They told me the size.
Now we'll continue with how to diagnose. Laparoscopy and palpation reassure the personal umbilical endometriosis. That is the only way you can diagnose the pathology. And we have the treatment. Treatment choices in the hospital should be that of exceptional surgery, so as to avoid lesion reflux and the treat oncologic transformation. Despite umbilical endometriosis is already fine, usually small case series treated by laparoscopy and testing on pathology shows and complete resolution of the lesions and the symptoms. And we have a conclusion. The conclusion is that pelvic endometriosis is a common condition, but the diagnosis of primary umbilical endometriosis is difficult and different tests should be considered. In this case, a study suggests that a different diagnosis of endometriosis should be considered when umbilical is not a person is a woman of reproductive age. Thank you.